HIV. Research shows the Deep South has the highest rates of HIV diagnosis.
While advanced treatments have made it possible for people with HIV to live normal lives and not to pass the virus to others,
Houston's HIV rate is more than double the national average. Black communities are testing positive for every major STI on the chart, while every other group in the same county stays flat. Katt Williams looked at those numbers and said someone had deliberately built that, and he had names. The mainstream called it a conspiracy. Then the federal government published a 7-year study describing the exact same system, in the exact same neighborhoods, producing the exact same outcomes. So the question was never whether Katt was wrong. The question is, why did nobody in power want him to be right? Join us as we find Katt Williams Exposes, who is behind the Houston STD Breakout. The numbers they ignored. Harris County dropped a public health report, and the numbers it revealed were not subtle. Houston's HIV incidence rate landed between 21.6 and 25.6 cases per 100,000 people. The national average sat at 11.4. Texas as a whole came in at 15.7, already above the national figure. However, Houston passed both by a wide margin, more than double the national HIV rate inside one of the most well-funded counties in the entire country. And that was just new infection documentation. The report also tracked people already carrying the virus. Nationally, that number sat at 308 per 100,000. Texas came in at 327. Houston landed between 464 and 566, nearly double the national figure for existing cases alone. This crisis had been building for years before any of it started trending online. Now look at who was getting infected. Black communities across Harris County were testing positive for HIV, chlamydia, gonorrhea, and syphilis at rates that outpaced every other group in the county. The gap was not small. Black women who identified as heterosexual were among the fastest-growing groups for new diagnoses. That undermined the idea that this was a lifestyle issue confined to specific communities. The data did not support that conclusion. The geography told the same story. The highest concentrations of new HIV cases showed up in 3 neighborhoods: Montrose, the 2nd Ward, and Sunnyside. These were not random locations. They were areas that had been historically underfunded in healthcare, schools, and economic opportunity. The crisis had a map, and that map had a pattern.
HIV, syphilis, gonorrhea, chlamydia, all of those. So it's a big issue we have here in our community.
Chlamydia was highest among people between 15 and 24. Gonorrhea went up every single year between 2016 and 2022. No plateau, no reversal. Syphilis more than doubled across that same 7-year window. Every major STI in the report was moving in the wrong direction, and black communities were carrying the largest share of all of them. Researchers pointed to healthcare access as the main driver. People in those areas were not getting tested early enough. When they did get tested, treatment was slow or inconsistent. There were gaps at every stage: testing, diagnosis, treatment, and follow-up. Each gap gave infections more room to grow. The report was careful and measured throughout. It used words like structural barriers, underinvestment, and distressed neighborhoods. Nobody named anyone. Nothing pointed at a specific actor. Everything got framed as the result of long-term neglect and historic underfunding. But one question sat under all of that careful language, and the report never answered it. Harris County had the money. The infrastructure was there. Houston was not some forgotten, under-resourced pocket of the country. And yet the gap between what was available and what black communities were actually receiving kept growing, year after year, in the same neighborhoods, affecting the same people, while the same institutions watched. Katt had a different word, and unlike the report, he also had names. Whose? Katt's shocking argument. Katt did not build his argument around what black people were doing. He built it around who set up the board before they ever had a chance to make a move. He started with fentanyl. The drug was devastating black communities across the country at a scale that was hard to look away from. But the people manufacturing it, packaging it, and running it at volume were not coming from those communities. Someone else built the supply chain. Someone else controlled the distribution. The communities absorbing the worst damage had no part in building the system that was destroying them. Katt held that gap open and pointed directly at it, because if a group is taking the most damage from a system they had no hand in creating, that is not an accident. That is a position they have been placed in. He applied the same logic to Houston's HIV numbers. Who built the conditions and who was absorbing the damage? Then he went into the music industry, and this is where it got specific. Katt had spent 3 decades inside that world. He knew how decisions were made at the top. The major labels distributing most of the rap and hip-hop reaching black audiences were not owned or run by black people. The executives making the decisions, who got signed, what got funded, and what content received the marketing budget to reach the widest possible audience, were white, and not one of them lived in the neighborhoods most affected by what they were selling. Those labels were not neutral platforms. They were active curators with a financial playbook. What Katt said had consistently made the most money was content built around a very specific set of values: promiscuity as status, using protection as weakness, women as disposable, heavy substance use as a lifestyle, and gang involvement as identity. All of it was packaged and sold to black audiences as authentic cultural expression, as something that came from the community, not something being engineered and fed back into it. Artists did not have real options. The ones who made something different did not get the backing. No marketing budget, playlist support, or label investment. If you needed to pay your bills, you made what the label wanted. The executives collecting the revenue from all of this went home to gated communities. Their children attended private schools. None of them were living inside the environment they were profiting from. Katt said the health consequences were predictable. Spend 20 years selling a generation of young black men and women on the idea that promiscuity is status, that protection signals weakness, that sleeping with as many people as possible is what freedom looks like, and then check the STI data.
Highlighting how HIV disproportionately impacts the black community.
Then he mapped it all together, where HIV rates were highest, where healthcare was hardest to access, where school funding was lowest, and where economic mobility had been blocked the longest. He said the outcome was the product of a system deliberately built to produce it. Then the federal government published a report that confirmed almost everything Katt had already been saying. How? Then the government confirmed it. The government report used the word disparities. Katt used the word design. Put both side by side, and they were describing the same outcomes. That is where this gets uncomfortable. The Harris County Public Health Report ran from 2015 to 2022. 7 years of data broken down by age, race, neighborhood, and year. No one from the entertainment industry commissioned it. The federal government built it, published it, and largely moved on. But what it showed was a near-perfect match to what Katt had been saying publicly for years. Chlamydia, gonorrhea, and syphilis all followed the same curve across the entire study period. Every category trended upward. Every category showed the same racial disparity, significant, not marginal. Congenital syphilis, passed from a mother to her child during pregnancy, appeared in the data set. That was not a behavioral statistic. That was a generational one. The infection had been moving through families. The researchers used specific language about healthcare access. They stated that access to quality care played a critical role in early detection, timely treatment, and counseling. They stated that gaps in access directly impacted HIV outcomes, and people facing barriers to testing and treatment were the ones the numbers kept finding. 7 consecutive years of county-level federal data. The same gaps every time. The same communities every time. The researchers went further. They stated directly that young people living in distressed neighborhoods, places without safe recreational spaces, limited health resources, and high crime, showed disproportionately higher rates of multiple sexual partners, STIs, and assault. Then they listed the neighborhoods by name. Montrose, the Second Ward, and Sunnyside, the same places highlighted in the earlier HIV data, are the same communities that continue to show the same outcomes across every category. The proposed solutions were to expand free testing, strengthen community education, and increase prevention strategies. But the gaps being described had been sitting in that same data set since 2015. The county had been watching the decline for nearly a decade before Houston became something anyone outside public health circles was discussing. Katt had not seen this report when he started making these arguments. He was describing what he said he had personally watched from inside an industry for over 30 years. Then the federal government ran a 7-year study and confirmed it. Different language, same picture. The researchers called the conditions that produce these outcomes structural. They described the neighborhoods, the funding gaps, and the healthcare access barriers. Katt had used a different word for all of those combined, but the outcomes they were each describing were identical. The people who produced that report never followed their own data to its logical conclusion. But someone else had already tried, on national television, in front of one of the most recognizable interviewers in the country, 24 years earlier. Someone said all of this on national television in 1998, then watched it disappear. Who? Will said it, in 1998. In 1998, a television interview aired that the mainstream media had been quietly left alone for over 2 decades. Will Smith sat across from Barbara Walters on camera on a major national platform, one of the most recognizable journalists in the country, interviewing one of the biggest recording artists, and made a statement that should have generated years of serious follow-up journalism. It did not.
People ill with the AIDS virus, this is pretty serious stuff. Do you really feel that?
Once a drug existed that could manage the AIDS virus without curing it, keeping people alive but permanently dependent on treatment for the rest of their lives, someone was positioned to generate an enormous and indefinite amount of money from it. And the model was already beginning to play out exactly the way he framed it. Will went further. He told Barbara on camera that he believed the AIDS virus had originated in a private laboratory, not as an accidental byproduct of research, but as a deliberate product of genetic warfare testing, developed with that financial outcome already built into the plan from the start. The antiretroviral industry became one of the most profitable sectors in global medicine, generating hundreds of billions in revenue, while the communities with the highest infection rates remained the least able to afford access without institutional support. Barbara pressed him directly. She asked if he understood the weight of what he was putting his name on. He acknowledged it clearly. He said on camera that he knew people were going to come after him for making those statements. He said it anyway. What followed said as much as what he said. That specific portion of the interview did not circulate through mainstream media channels. It did not generate the coverage that a public figure of his profile, making those claims on that kind of platform, would normally produce. The interview existed in the public record. It just never became part of any major conversation about Will, about AIDS, or about the industry he had spent years embedded in. When the footage resurfaced decades later during the Houston conversation, people who had followed Will closely for years said they had never seen it. The clip had simply not traveled through the channels most people use. The late 1990s were a specific moment to make that argument publicly. AIDS was actively devastating Black communities across major American cities. The crack epidemic had already torn through those same communities in the decade before. Will had been watching both happen from inside an entertainment industry he had serious and growing doubts about. His proximity to that world gave him access to conversations that most people on the outside never encountered. He said on camera that what he believed came from what he had personally encountered, not from public sources. No major outlet investigated the pharmaceutical threat he had just described on camera. The clip sat untouched for 26 years. The global market for antiretroviral drugs was valued at approximately $26 billion in 2023 and is projected to reach $45 billion by 2030. Gilead Sciences alone reported over $17 billion in HIV product revenue in 2023. The communities carrying the highest infection rates have consistently been the least positioned to afford those drugs without federal assistance. Then Houston happened. The footage came back, and millions of people watched it for the first time and noticed something. The financial mechanism he described in 1998 had played out almost exactly the way he said it would. But before any of this, the US government had already been running a version of this for 40 years, and they got caught. How? 40 years, 600 men, 1 leak. The Tuskegee study was not a rumor. It was not a theory pieced together from old newspaper archives. It was a documented federal government program, funded and managed by the U.S. Public Health Service. It ran for 40 years, from 1932 to to 1972. The Public Health Service recruited 600 black men in Macon County, Alabama. The men were told they were being treated for bad blood, a local term covering a range of health conditions. They were poor. They had no meaningful access to health care outside of what this study offered. They had every reason to trust the people presenting themselves as their doctors. They were not being treated for anything. What the researchers were actually doing was watching what happened when syphilis was left completely untreated in the human body. No intervention, no medication, no attempt at a cure, just observation. The men were never told this. They were never told they had syphilis. They were told they had bad blood, and that these people were helping them. Only one side knew what the arrangement actually was. In 1947, penicillin became the established cure for syphilis. It was cheap, available, and proven, but the researchers did not tell the men. They did not redirect them toward treatment. They kept the study going exactly as it had been designed, which required keeping the men untreated. Withholding a known, affordable cure from men with a fully treatable infection was a documented, deliberate choice. They needed their subjects to stay sick to keep collecting data. The study then ran for another 25 years after penicillin was already widely available. More than 100 men died from syphilis or its direct complications during that period.
In the end, as many as 100 men died from complications related to untreated syphilis.
Others went blind. Their wives were infected through normal contact they had no reason to avoid because nobody told them what was happening at home. Children were born with congenital syphilis. Families were damaged across generations while researchers filed their reports, and the government kept signing the checks. The study did not end because anyone inside the system developed a conscience. It ended because a researcher named Peter Buxton had been raising concerns internally for years, had been dismissed every time, and finally took what he knew directly to a journalist. That journalist was Jean Heller of the Associated Press. Her story ran on July 25, 1972, on the front pages of newspapers across the country. Within days, a congressional hearing was called. The study was officially terminated by the end of that year, 40 years after it began. The government's formal apology was delivered in 1997.
What the United States government did was shameful, and I am sorry.
25 years after the study ended, 65 years after it began, of the original 600 men, only 8 were still alive to hear it. Harvard researchers later documented that the 1972 public disclosure alone widened the black-white life expectancy gap measurably. Black men stopped going to doctors. The distrust caused additional, compounding harm for decades after the study had already ended. When Katt pointed at Houston and said this kind of harm had a historical precedent, he did not need to speculate. The federal apology was on record. The documentation was public. The only question the record left open was whether it had actually stopped. Most people assumed it had. Tuskegee let people die passively, but somewhere else, a government was actively spreading it. Where? They said it on camera. South Africa under apartheid produced one of the most direct confessions of deliberate biological targeting of black people ever captured on camera, from someone who said they were personally inside the operation when it ran. During the apartheid regime, the AIDS virus was being deliberately spread to black South Africans by people connected to the white government. That claim did not come from an outside researcher or a journalist working from archived documents. It came from someone with first-hand operational knowledge of what was being done and why. People presenting themselves as medical workers went into black communities and offered inoculations. Residents showed up believing they were about to receive protection. They were being exposed to the virus instead. The mechanism worked because it was built around trust. Black communities had every reason to engage with healthcare outreach. That trust was the access point. The harm was designed to look indistinguishable from care. At the time, AIDS had no cure and was nearly universally fatal. No military presence was required. No open conflict. No incident that could be traced directly back to a specific actor. The virus moved through a population quietly and did its work over time. The people responsible maintained distance from the outcome. It was described on camera, in plain language, as a non-military approach to elimination. The stated goal was the retention of white supremacy on the African continent. The black population was the primary obstacle to maintaining the power structure built under apartheid. Reducing that population through biological means, without the kind of visible operation that would draw international attention, was a strategy that had reportedly been developed, approved, and put into action. The interview did not move through mainstream Western media. It circulated in academic and activist spaces, but never became a reference point in the dominant conversation about AIDS in Africa. That conversation stayed focused on sexual behavior, cultural practices, and healthcare infrastructure. The possibility that any portion of the epidemic had been deliberately accelerated through targeted infection was not something institutional voices engaged with seriously. But the South Africa account was not a theory assembled from inference. It was a direct first-person claim from someone who said they were inside those decisions, stated clearly on camera. Post-apartheid investigations by the South African government later confirmed that biological weapons programs had existed inside the apartheid security structure. Programs involving the development and potential use of agents targeting black populations specifically. That program had an official name. Project Coast ran from 1981 under the South African Defence Force, directed by a military cardiologist named Wouter Basson, with documented objectives that included targeting specific population groups. When those findings were released, major international outlets largely did not cover them. The information entered the historical record and stayed there. Tuskegee observed and withheld treatment. What the apartheid official described was active deployment, people sent specifically into communities to infect them under the cover of healthcare. Different methods, but the same target, both admitted and documented within living memory. And it leaves one question about 2026 completely open. Washington didn't inject anyone or run a study. In 2026, it just cut the funding. How? While Houston's rates climbed, Washington cut the hose. The Harris County report had built a precise map of the crisis. By 2026, federal funding cuts had systematically dismantled the resources positioned to respond to it. And while the online conversation was still focused on statistics and Katt's theory, almost nobody was paying attention to what was being quietly removed. Federal funding for HIV prevention had been under pressure since early 2025. By 2026, that pressure had turned into operational damage at service organizations across the South. The entire CDC HIV prevention program was facing elimination. The budget proposal on the table totaled $1.5 billion in cuts. The Minority AIDS Initiative, built specifically to address HIV in communities like the ones showing up in Houston's data, was facing reductions that would significantly shrink what it could actually do on the ground. At the research level, the numbers were equally direct. 191 NIH research grants focused on HIV were canceled. 383 clinical trials were shut down. 74,000 people enrolled in those trials were left without a study to be in. The projections from public health modeling were not loose estimates. The Ryan White HIV/AIDS program was signed into law in August 1990, named after an Indiana teenager who contracted HIV through a contaminated blood transfusion and died that same year at age 18.
This nation lost one of its leading figures in the battle against AIDS. 18-year-old Ryan White has died of the disease.
It currently serves more than 570,000 people annually. More than half are black. It is the largest federal program dedicated exclusively to people living with HIV. If the Ryan White HIV/AIDS program were ended, researchers projected approximately 75,000 additional HIV infections by 2030. That number was based on documented patterns of what happens to infection rates when treatment access disappears. On the ground, the damage was already visible before the full cuts arrived. HIV service providers across Texas and the surrounding states reported staff furloughs. Testing and outreach programs that had run consistently for years started pulling back hours and reducing geographic reach. Organizations that had been running mobile testing units into underserved neighborhoods, the kind that reached people who would never voluntarily walk into a clinic, started losing the budget to keep running. Houston felt it the most. The organizations doing prevention work in the specific neighborhoods that the Harris County report had flagged as hardest hit found themselves with reduced reimbursements and shrinking budgets, fewer testing slots, longer waits for treatment. Prevention programs in schools and community centers lost the staff positions needed to keep functioning. The Harris County report had precisely identified which communities needed the most urgent intervention. The funding cuts then reduced the capacity of the organizations positioned to deliver exactly that intervention. The official federal language described everything as budget efficiency and program consolidation, neutral, administrative. Nothing on paper is directed at any specific community, but the outcomes, mapped onto the neighborhoods most affected, were not neutral. The communities left most exposed were the same ones the Harris County report had flagged. Katt had been saying for years that the method shifted depending on the era. The result never did. Tuskegee in one period. The entertainment industry pipeline is another. In 2026, it was the quiet removal of the infrastructure that had been slowing down the damage from everything that came before. Meanwhile, someone fabricated a number, and it spread faster than any real data ever had. Real numbers were already alarming, but someone fabricated 42,000, and the internet believed it. Why? Where the evidence actually stops. In the middle of all the serious reporting about Houston's STI crisis, a specific number started moving across social media faster than any public health report ever had. Posts on Facebook and Instagram claimed that more than 40,000 people in Houston had been diagnosed with an STD in a single week.
It claims to show more than 46,000 people tested positive for various STDs in Houston just last week.
Right after spring break. Some versions put the figure at 42,000. Every version carried the same message. Houston had just experienced a catastrophic outbreak, and anyone who had been there needed to get tested immediately. The number moved fast. Video creators picked it up. Comment sections filled with panic. People who had actually been in Houston started posting about it publicly. Health scare content does this. It hits somewhere personal, and the sharing starts before anyone stops to verify the source. The Houston Health Department addressed it directly. The posts had grossly overstated the figures and were circulating incorrect information. What those viral posts actually showed was not a count of confirmed positive diagnoses from Houston in 1 week. It was a screenshot of the total volume of STD-related laboratory tests processed during the week ending June 17, 2024. That figure covered the entire state of Texas. It included both positive and negative results. It measured testing volume, not confirmed cases. Everything the posts claimed was wrong. The screenshot had originated inside a state health data system. The Houston Health Department described its appearance in those posts as a misuse of their system that violated department policy and triggered an internal security investigation. The Texas Department of State Health Services separately confirmed that no outbreak of that scale had been announced. No credible news outlet had reported anything close to 40,000 confirmed diagnoses from Houston in 1 week. Every health official who addressed it said plainly it was false. Houston's real numbers were already alarming. They did not need inflating, and yet someone stripped all context from a statewide testing volume figure, relabeled it as a one-city, one-week outbreak, and pushed it to an audience already primed to believe something catastrophic had happened. The fabricated 42,000 number traveled further in 48 hours than any actual Harris County public health report had managed across several years of publication. Katt's structural argument held. Healthcare disinvestment, neighborhood poverty, and decades of media content that normalized destructive behavior inside Black communities produced exactly the outcomes the data showed. The researchers stopped short of using that word, but the system they described, the neighborhoods, the funding gaps, the access barriers, the 7 consecutive years of identical outcomes, fit the definition whether they named it or not. That part of what Katt said mapped directly onto documented evidence. Where it moved into harder territory was the leap from structural neglect to an active, coordinated biological targeting program running in Houston in real time today. Tuskegee was documented. South Africa was documented. But the evidence did not fully close the distance between those historical facts and a live operational program in 2026. The structural damage was real and traceable. The active conspiracy claim was where the documented record ran out before the conclusion was fully reached. The neglect was real, and the distrust was earned. The funding cuts were making everything worse, regardless of anyone's stated intentions. The communities left most exposed were the same ones that had always been most exposed. If Tuskegee ran for 40 years, took 65 years to apologize for, and in 2026 the same protections get cut, when does that stop being negligence and start being a pattern? And if the same label structures are still deciding what reaches Black audiences and profiting from it, what's being delivered right now that we won't fully understand for another 20 years? Share your thoughts with us in the comments section. Remember to like, share, and subscribe for more. Also, click the next video showing on your screen. You will enjoy it.